Hi, friends. I'm Dr. Molly Brinkman. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. I'm holding my microphone today. We'll see how that goes. Hello, everybody. I have a hot take today. We're going to jump right into it. So this is a podcast that's geared towards pet owners, but I know that there are veterinary professionals who listen and watch it. But I think this may sound like it applies more to the veterinary field, but I think this is something important for pet owners to be aware of as a topic, as a sort of hot take, controversial thing. I think it's something we should be having discussions about, both veterinary professionals and pet owners, and probably together. So I want to help facilitate that discussion. I don't have all the answers. I don't have the right answers. I have thoughts. And so I just thought, I've been seeing some chatter about this on social media the last week or two. So I thought we can just talk about it here. I think we should probably have a guest on to talk about it, but I'm going to start the conversation by my lonesome. So there's been some in the sort of veterinary social media content creation space, some posts and some discussion, a little bit of tension about in veterinary medicine right now, the current state of vet med. Are general practitioners referring more patients than they should? Are they referring enough? Is the cost of referral veterinary care too high for most people? Some of the discussion is about how there seems to be a decline in general practice veterinarians who are willing or wanting to do surgery in more advanced cases. Okay, so that's what the conversation is surrounding. And there are a lot of people and a lot of opinions naturally about this. There are some veterinarians who feel like most GP vets should be comfortable doing a wide range of surgeries and services and be able to see, even more intense cases if they're open. And then there are others who feel like, GP veterinarians, if they're not comfortable doing that, they really shouldn't feel the need to do that. They feel like pet owners are more litigious than ever. So there's, I think, some fear about being sued if something doesn't go well and it could have gone to a specialist. And so that's the discussion. And that's, I think, where the tension is and the disagreement. And I see all sides of it. As someone who has worked in GP medicine for 10 years, I have worked in a lot of different practices. I've worked in a lot of different sort of scenarios, places, demographics as far as socioeconomic clientele status. So I feel, if you haven't heard me talk about this, I feel very strongly about spectrum of care, which is a newer thought in the veterinary space that's very, very important. My friend, Dr. Kate Boatwright, is doing a lot in to make people more aware of the importance of spectrum of care. And spectrum of care means when we as veterinarians see a client with a pet who needs XYZ treatment, we identify what's wrong with that patient and we say, this is what they need. And what a pet needs by the textbook, or in an ideal world where money is no object and there's no cost associated with veterinary care, we as veterinarians know what's the best possible thing that we could do. What are the most extensive diagnostics we could run to get to the bottom of this? But reality, especially for those of us who work in GP, tells us that people's budgets often don't match what that gold standard diagnostic or treatment option is. So, for example, if a patient comes in and, they have some type of GI upset, a GP veterinarian is completely right to offer a full workup, blood work, x-rays, potentially abdominal ultrasound, pancreatic lipase testing. Totally fair. That's what the textbook would say to do. That's what vet school would say to do. But in most veterinary practices now, that type of workup, we're talking $1,000 easily. And that's just not what a lot of pet owners can do. And so what Spectrum of Care does is it says, okay, when a pet owner can't or isn't willing to do option A, what are you going to offer as option B, C, D to still take care of the patient, but work within the financial means of the client? And this is really important. And it's something I wish more veterinary professionals were talking about, because the cost of veterinary care is rising, just like the cost of everything is rising. The cost of groceries is getting higher and higher. It's harder for people to feed their human families. And so this is really important. It's important that pet owners understand what Spectrum of Care is, because depending on what type of veterinary practice you're in, even within GP, if you're in a practice, especially ones who are owned by corporate groups where doctors are sort of required to offer XYZ things, I think it's important for you to understand that you don't have to do all of those things. If you cannot financially do all of those things, it is okay. It is fair. It is completely normal for you to say, I can't afford that estimate for all those things. What would be the next step, the next best route to get to an answer or to treat my pet? Would it be fair to do some treatments? And are there any diagnostics that we can skip? What diagnostics would you, as my veterinarian, prioritize in this situation if I was trying to decrease the amount I spend on this workup? So that's why I think it's important for pet owners to understand this discussion. So when we go back to the sort of what's happening on social media right now, is there does seem to be a trend where newer grad general practice veterinarians are wanting to do less surgery beyond more kind of routine GP surgeries. There's no such thing as a routine spay, but spays, neuters, small growth removals, skin biopsies, kind of more basic things. And they're no longer, some newer grads, and not just new grads, but some veterinarians are more hesitant to do more involved surgeries, like take a spleen out or do intestinal surgery, which is completely understandable. I think training for surgery in vet school is somewhat limited in a lot of programs. And so I understand why some veterinarians are uncomfortable with those things. And some people just don't really like surgery, and that's okay too. But where I understand where some of these vets posting about this are coming from is, if all GP veterinarians decide, hey, I'm not going to do any advanced surgeries because I'm worried I might get sued, or I didn't get trained how to do that, and I don't want to learn how. Eventually, if everyone decides that, then the only option for pet owners is going to be a specialist. And veterinary specialists are very, very important to our field, to our patients. But what they offer is very different from what GP offers, and the cost associated is very, very different. And so my fear is that if we don't encourage veterinarians to be more comfortable in surgery, GP vets, be more comfortable trying things that an owner couldn't otherwise afford with a specialist, then we could end up in a situation where specialty is the only option, and it is very cost prohibitive. And most specialty groups are owned by large corporate entities, and so that drives the cost of that care up. So anyway, I just want to bring light to this discussion. My personal feelings are somewhere in the middle. I think as a GP veterinarian, I try to be very transparent with my clients. I try to make them feel comfortable discussing their financial means for a given scenario. I try to take shame away from, like, hey, if this $400 workup isn't in your budget, great, let's make a new plan. And I think it's good for especially new grads to understand that it's okay to, and always good and right to, offer referral to specialists in a lot of scenarios. But you have to have a plan if the answer is, well, no, I can't go to that specialist. And so I think this is something that pet owners and veterinarians can work on together. I think this is why private veterinary practice is very important, because locally owned clinics where an actual human being in the building or available to be in the building in 15 minutes is who's running the practice can help guide these decisions and how we deal with these financial situations with our clients. So anyway, I guess my hot take is that both perspectives are right in some ways, but extremes are usually not the answer. And if everyone decides in GP medicine they're not going to do anything beyond basic wellness and basic surgery, then pet owners are going to be in a pickle. So for me, I love surgery. I always say I'll rodeo. So I offer referral when it's appropriate. And when a client can't do that and their pet needs some type of life-saving or quality of life-saving care, 9 times out of 10, I'm willing to do that or try that. And I'm transparent with owners. I think 99% of veterinary medicine is communication. I know some vets are worried about being sued, but I feel very strongly that if we communicate appropriately, we let owners know, hey, I've done this surgery twice. I've definitely told owners that. And they understand, then it's fine. We document that. They understand the risks. And they're willing to take them to get it done because they couldn't do it otherwise. So, it's a complicated topic. There's a lot of nuance. There's a lot of right answers. I do think there are some wrong answers, and most of the wrong answers are the extremes. And I see both sides. I definitely have worked around veterinarians who refuse to refer, and that's a problem. And as a pet owner, I think it's important that you know or have some type of handle on when would be an appropriate time to go to a specialist. I think dermatology is underused in veterinary medicine. I think more of our patients should be referred to dermatologists. I know that going to specialists sometimes to clients feels like it's expensive, but if you can get to a solution faster by going to see the expert in that field, like dermatology, you actually spend less money in the long run because you're not going to your GP vet over and over and over again for the same problem and not getting different results. So that's just also a reminder for pet owners, like you can ask for a referral. There are veterinary specialties in all aspects of medicine now. There are boarded, if you didn't know, boarded surgeons, boarded neurologists, cardiologists, oncologists, dermatologists. I'm forgetting a lot of things, but just all of the categories of medicine pretty much now in veterinary medicine, there's a specialist for that. Nutrition. You can be referred to a boarded nutritionist, behaviorist. So anyway, it's a little bit of a soapbox of mine. I want to encourage younger veterinarians who are interested in doing those things. There's a lot of opportunities to get training to do more surgeries if you're interested in that. You can learn from old veterinarians like me that have been doing more of it. So find that mentorship if you're interested in it. And I encourage you to try to find locally owned private clinics who are facilitating and encouraging that. Okay. That's my hot take. I would love to hear your thoughts about this, especially as pet owners, veterinary professionals as well. I want to know what you think. But pet owners, what do you think? What's your perspective? Do you have experience with this? Would you prefer that your general practice vet refer you more quickly to a specialist? There are also studies that show that when GP vets refer their patients to specialists and stay involved in that, everyone is happier and patient outcomes are better. And that's something that Dr. Ben Bergstrom, the ophthalmologist, veterinary ophthalmology is a specialty too, and I have talked about a lot. He owns a privately owned ophthalmology practice here in Nashville, and that's one thing he prioritizes, and all the other doctors and everybody, all the staff at his practice, is that they work in very close collaboration with the GP vets that refer patients to them. And I think that's really important. I think that serves everyone really well, most importantly, our patients and their owners. And I think a lot of other specialty groups should take notes from practices like the iVets. And I've, not always had great experiences with referring patients to specialists. And specialists have a lot of bad experiences with GPs that refer to them. So I think we can all do better. We can all work better together to serve our patients. So let me know what you think. All right, let's get into the meat and potatoes of the episode. So today we're going to do a topic that's a little bit shorter than a lot of them. It's somewhat straightforward, but I think it's important. And we're going to talk about this because of a sweet patient that I saw last week. I posted about her. Her name is Rue. And Rue came to see me last week because her mom said she had been, every time she went on a walk, she was peeing a little bit in a bunch of different places. And then her owner's daughter said she thought she saw some pee in her urine maybe. So mom was thinking that Rue had a urinary tract infection. And Rue is a middle-aged Shih Tzu. And so I saw her on exam, like everything physically looked pretty normal. So we immediately decided to go ahead and test her urine for any signs of infection. I did get her urine sample by doing what's called a cystocentesis, where we use an ultrasound and put a needle directly into her bladder through her belly and pull urine from the bladder. There's a lot of reasons why I prefer to collect urine this way, and Rue's case is one of the big reasons because I can see what the bladder looks like by using that ultrasound. And sometimes we catch abnormal things in the bladder by doing that. And in Rue's case, that's exactly what happened. So if you haven't seen the video, go check out on my page, Dr. Molly Says. There's a great little video of what the ultrasound looked like. So when I ultrasounded her bladder, I could see that Rue had a bunch of stones in her bladder. She had bladder stones. There were several in there. They were very obvious on ultrasound. We did get a urine sample, though, because while I knew that her stones were probably contributing to her symptoms, we definitely wanted to see if she had an infection. So she did, in fact, have a urinary tract infection. There was bacteria in that urinalysis. So we started her on antibiotics to treat the infection. We took an x-ray as well of her abdomen because on x-ray, we can see sort of bigger bird's eye view of the bladder, see how many stones, how big they are. And so we could see she had like 20, 30 something small round stones in her bladder. So her mom was not expecting that news, which is often the case the first time we find bladder stones in patients. But Rue is kind of a poster child for a dog with bladder stones. So she's a small breed Shih Tzu, middle-aged, and she presented for frequent peeing and possible blood in urine. And this is how a lot of patients with bladder stones come to us with those symptoms. So let's talk about, oh, and by the way, I posted that I would share pictures from Rue's surgery, but joke's on me because I saw Rue on, I think, Thursday, and she ended up having surgery at the clinic on Friday with another doctor because she just started to be really uncomfortable from her stones. So I don't have pictures from Rue's surgery, but she did great. She's at home recovering, and her bladder stones have been sent out to the Minnesota Urolith Center, and so we're going to find out what kind they are. So if you have never really heard much about bladder stones, our pets can definitely develop bladder stones. True bladder stones are a bigger problem in dogs than cats, so we're going to focus on dogs. Cats have a whole few episodes worth of urinary problems, so we're going to talk about those at some point. But dogs can develop bladder stones. One thing I hear from clients pretty often is they think they're talking about kidney stones. They refer to stones as kidney stones, but I know they're really talking about bladder stones. So this is one thing I just want to make sure you as a pet owner understands is that dogs can have kidney stones, but they're very, very different from bladder stones. So bladder stones are way more common in dogs, and they are actually within the urinary bladder, not the kidneys. So when we think about humans having kidney stones, this is different. But kidney stones do go into the bladder before they come out. But these are stones that form in the bladder. If you didn't know, the urinary bladder is a whole party. There is a lot that goes on in the urinary bladder. A lot can happen in the urinary bladder in dogs and cats, and a lot can go wrong. So bladder stones are basically what they sound like. They're stones. They can be different shapes and sizes, but they're just a mineral concretion that forms in the bladder. Most bladder stones are going to form because a bunch of, or all of them, crystals, certain types of crystals, mineral crystals will stick together. And because of other things in the bladder, they will solidify and become a stone. Bladder stones can be actually very pretty cool looking stones. A lot of veterinarians have bladder stones on their desks as paperweights, but these stones form over time. Certain ones form faster than others. There are a lot of different factors that can cause stones or make dogs more predisposed to having them. Genetics can definitely play a role. There are definitely some breeds that are more prone to getting bladder stones. We think about a lot of smaller breed dogs with bladder stones. So dogs like Roo, Shih Tzus, Yorkies, Lhasas, I've got a list in here, but smaller dogs are more common to develop bladder stones, but any dogs can. There's a lot we talk about. There are different kinds of stones, and so the environment in which they grow has a lot to do with what kind of stones we might see. So I kind of wanted to break down for you the types of bladder stones we can see because there's some important differences in those. So the first and most common we see is called struvite stones. So struvites and calcium oxalates are the two most common stone types that we see in dogs. What's interesting about struvites and calcium oxalate stones is that they each form in different types of urine pH. So struvites, the thing I want you to remember is that struvites are often secondary to infections. So bacteria that causes urinary tract infection can lead to a rise in the pH of the urine. So struvite stones actually form in alkaline urine. Okay, so the pH is higher than 7 typically. That leads to more crystal formation, and then crystal formation can lead to stone formation. So struvites are an interesting type of stone because actually struvites can be dissolved with certain diets. So there are diets that will acidify urine. They target like 6 to 6.5 pH. And certain struvites can be dissolved by changing the urine pH, which is very interesting and very cool. Science is cool. And so you may have heard of prescription diets that treat certain bladder stones, and that's one of them that can treat struvite stones. So struvites are very, very common. Like I said, antibiotics treating the infection and diets that change the pH can actually resolve those. So not all struvite stones require surgical intervention. The other most common type of stone is called calcium oxalate. Calcium oxalates are opposite from struvites in that they form in acidic to neutral urine. They typically are not able to really be dissolved. And so once we have calcium oxalate stones actually formed, they have to be removed in some way. And like I said, these are common in small breed dogs. Cats can develop calcium oxalate stones as well. And when we try to remove calcium oxalate stones, once we identify them, there's a few ways we can do that, which I'll get into. But a lot of those dogs do require surgery to actually open the bladder and remove those. So this is fun. There's a new type of bladder stone that's just very recently been formally identified. I'm still learning about it, but these are called calcium phosphate carbonate stones. They're in some ways similar. They're similar to struvites and calcium oxalates in different ways. They're kind of like a hybrid of the two as far as what they do, which I'm worried makes them more complicated, but research is still ongoing, so we'll see. So these are stones that actually form in alkaline urine. Okay, so they're like struvites. They form in alkaline urine. We think that they may be linked to chronic infections, so similar to struvite in that way. But the bad news is the researchers don't think that they can be dissolved like struvites can, and so they probably have to be treated and managed like oxalates. So that's a bummer, but very cool. New bladder stone, calcium phosphate carbonate. I will keep you all posted, anything new I learn about them as more information comes out. So then the other types of urine or bladder stones that we can see are pretty rare. So urate, cystine, and silica stones. These are a lot less common. Urates, cystines, these can be genetically related. These can form because of liver issues. There is a genetic predisposition in Dalmatians actually for some of these, and then dogs who have liver shunts can be prone to these. So those are pretty rare. We don't really need to talk a whole lot about them because if your veterinarian ever finds those stones in your dog, they're gonna think it's really cool. And then your dog probably needs help with something else. So if your dog or cat has bladder stones, this is what they're going to do. They're going to start to pee more often. Particularly when they pee, they'll often pee small amounts. So you'll notice a dog might just pee a little bit here, a little bit there, just kind of pee small amounts all around the yard or wherever they pee. They can strain when they are urinating. It can be uncomfortable for them to urinate because those stones are moving around and can irritate, not urinate, the bladder and the urethra. You can see blood in the urine. And then they do often have urinary tract infections. It kind of goes hand in hand. And so that also causes symptoms like blood in urine, increased frequency or urgency. They can have urinary accidents. So any type of abnormal urinary symptoms can always be a sign of bladder stones. Urinary obstruction is the real concerning problem with stones, right? So male cats, which we're going to talk about this in another episode at length, but male cats are very, very prone to getting urinary obstruction. So their urethra actually gets plugged up with urinary that can be stones. And that is a true medical emergency because the longer that they're unable to pee, their bladder fills up, that backs up into their kidneys. They can go into kidney failure, and cats absolutely die from having urinary obstruction. So they need to be unobstructed as soon as possible. This can also happen in male dogs. They can get obstruction in their urethra from a stone. The anatomy of the urethra in males and females, for both dogs and cats, is very different, and that makes males more at risk for having a dangerous obstruction. I have seen female dogs and cats be obstructed, but that is much more rare. So that's really the emergency side of urinary obstruction, especially in cats. So the way we diagnose bladder stones, usually from, like I said, imaging, we do an ultrasound or an X-ray, and we see them. We can see on urinalysis when we evaluate urine, we can see crystals. Crystals don't necessarily mean stones. So just seeing crystals in a urine sample does not tell me that a dog or a cat may have stones. It's just a clue along with the pH and then whether there's an infection or not. X-ray is the quickest way to just look really quick. Does this dog have calcium oxalate or struvite stones? Because they're going to be very radiopaque. They show up like rocks on the bladder, and then X-ray, they're very easy to see. It's a very quick diagnosis. And then on ultrasound, like I showed in that video, we can see as well. Anytime we find bladder stones, we want to make sure there is or isn't a urinary tract infection. And so we'll often, if we don't see bacteria in the urine, we'll culture for it. And if we don't do that at the time that we find the stones, we definitely will eventually do that if we have to do surgery to remove them. But pretty much we want to be positive that there is or isn't an infection, because we would always want to treat that before we get too crazy talking about treating stones. And then the only way to know what kind of stone we have is to send that out for analysis. And like I said, there's a Minnesota You're a Listener, and they're like, who does the bladder stones? So we have to send a stone that we retrieve from the bladder out to find out what it is. So once we identify stones in the bladder, before we get a quantitative stone analysis, there are clues that tell us what kind this probably is. So the pH of the urine, what kind of crystals are there, can give us clues and help us guide on how we want to treat it. If we suspect struvite stones and we're not worried about a patient being obstructed, a lot of veterinarians are going to treat an infection with antibiotics or rule out an infection and then try to dissolve those stones with one of the prescription diets I was talking about. We have some really, really cool prescription veterinary diets for dogs and cats that do magic things in the bladder to treat and prevent stones. So they can dissolve some struvite stones and prevent them. And then there are some diets that can help support patients that have calcium oxalate and other types of stones. But again, those usually cannot just be dissolved. They have to be treated in some way. So to treat calcium oxalate stones or large struvite stones or other stones that need to be removed, Most of the time, they're going to require some type of surgical intervention. In traditional GP veterinary practice, what I'm going to offer is what we call a cystotomy, where we actually put a patient under anesthesia. We open their abdomen, we actually open their bladder and physically, manually remove all the stones from the bladder. This is a pretty, well, for some people, straightforward surgery. This is a surgery I perform a lot, like to do it. We have great success, very, very low complication rate with these surgeries. The bladder is a very forgiving organ. It heals really well. And so surgery usually goes really well. So the big thing is we get all those stones out. We have to put a urinary catheter in that patient when we're doing surgery, make sure we flush everything out, take an x-ray after to make sure we've removed all the stones. Some stones can be removed by placing a urinary catheter and kind of flushing them out without doing surgery, especially if we've been on a diet that's made them smaller. And then there are some options with more specialty type centers to break up those stones within the bladder and remove them, like with a scope. So those are some non-surgical ways to remove those stones. People always want to know, once we've found and removed bladder stones from a patient, how do we keep that from happening again? Struvites are one of the more able to prevent stones, so keeping them on that special diet to prevent recurrence is really, really important. That's going to keep their urine a little bit acidic. With oxalate stones, we do want to avoid their urine being overly acidic. We don't really, unfortunately, in veterinary medicine, have great proven ways to prevent reforming of calcium oxalate stones. So that's the bummer, is that if your dog ends up having calcium oxalate bladder stones, there is a good chance they may reform and they may have to have surgery again. There are things we can do to try to help. I do believe that trying to keep these pets really well hydrated and keeping their urine more dilute can help, because their bladder is just less of an irritated place if they have real dilute urine. We want to provide fresh water fountains, encourage drinking. We want to control infection in these dogs. Some of these dogs, there's some type of an anatomical reason or some reason that they're having repeat urinary tract infections, which can lead to these stones. And so we want to keep those under control. We want to monitor their urine, test for infection. We want to treat urinary tract infections early. If they have a hooded vulva that can lead to secondary infections, we want to treat that with surgery. I will do it. There are some supplements that are tried for these patients. There's some thought that, and some evidence that potentially potassium citrate supplements can help prevent calcium oxalate stones. Research says that might not be ideal for this new type of stone, the phosphate carbonate stone. So this is another reason why it's really important to determine what kind of stone we're dealing with. There's thought that cranberry extract, which is in a lot of bladder supplements for dogs, can help. The evidence is not super strong for that. I don't know of really any harm in that. So humans also, drink cranberry juice when they have UTIs. So something else that some people try. And then just very close monitoring. So imaging every 6 to 12 months. Do we have stones forming? When do we need to intervene with surgery? And really staying on top of infections are really important. So that's kind of the big picture of bladder stones. They are fairly common, something we see in GP a good bit. We do cystotomies, I would say, probably on a monthly basis. We're usually doing a couple of cystotomies. And we do have repeat cystotomies. If your pet is a good candidate for anesthesia, I wouldn't stress too much about having to do multiple cystotomies. We want to limit that, Obviously, we don't want to do that over and over again. We don't want to have to cut into the bladder over and over again. But like I said, the bladder is a very forgiving organ, and a lot of those patients do really well even with repeat surgeries. So if you have specific questions about bladder stones, anything I didn't answer here, please let me know. Send me questions. You can DM me, Dr. Molly Says Pod, through our Instagram. We also have a link where you can submit questions. So I hope this is helpful. I hope it helps make sense. And anything, medical questions about this, always chat with your vet about what's best for your dog. but let me know what follow-up info you'd like, and I will try to answer those maybe on our next episode. So I hope you all found this helpful, and we will see you next week on the Dr. Molly Says podcast.